Are you beginning a career in addiction counseling or looking to stay current in your field? Then Addiction Counselor Continuing Education is a critical step in your professional journey. NetCE has you covered. In this video, we'll take a look at a brief overview of substance and behavioral addiction. After the overview, start learning with more resources and in-depth addiction counselor continuing education at netce.com. Addiction is a complex and multifaceted condition that affects individuals from all walks of life, regardless of age, gender, or socioeconomic status. For addiction counselors, understanding the causes and symptoms of common behavioral and substance use disorders is the first step in treating clients suffering from addiction. The causes of addiction are multifaceted. Some of the biggest drivers include genetics. Research suggests that individuals with a family history of addiction, particularly first-degree relatives like parents or siblings, may have an increased susceptibility to developing addictive behaviors. Environmental factors. Children raised in unstable or abusive environments may be more prone to substance abuse as a coping mechanism. However, supportive family structures, positive relationships, and community engagement can mitigate the risk of addiction. Trauma. Trauma often leads to emotional difficulties, including substance abuse, as individuals seek relief from distressing symptoms. Underlying mental health disorders. Conditions like anxiety, depression, and bipolar disorder can exacerbate feelings of stress and anxiety. These can drive individuals to self-medicate with drugs or alcohol as a means of coping. Brain changes. Prolonged substance abuse alters the brain's chemistry, particularly its reward circuitry, leading to diminished dopamine production and impaired pleasure response. Consequently, individuals may rely on drugs or alcohol to experience pleasure, perpetuating the cycle of addiction. Addiction is linked to a wide variety of substances and behaviors. Let's look at some of the most common. Opioid Use Disorder. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5-TR, defines opioid use disorder as a problematic pattern of opioid use. This leads to clinically significant impairment or distress. The diagnosis of OUD is made by meeting 2 or more criteria in a 1-year period. Criteria includes opioids taken in larger amounts or over a longer period than was intended, a persistent desire or unsuccessful efforts to cut down or control use, excessive time spent to obtain, use, or recover from using the opioid, craving or an intense urge to use. Opioid use interferes with obligations, continued use despite life disruption, reduction or elimination of important activities due to use, recurrent use in physically hazardous situations, continued use despite physical or psychological problems, withdrawal, increased tolerance, which can include a need for increased doses of the opioid for the desired effect or a markedly diminished effect with continued use of the same amount. The toxic side effects and addictive potential of opioids have been known for centuries. These undesired effects have prompted a search for a potent synthetic opioid analgesic free of addictive potential and other complications. However, all synthetic opioids introduced into medical use share the same liabilities of the classic opioids. Alcohol and alcohol use disorder. All drugs of abuse affect the brain's reward pathways. The effects of alcohol appear to be related to complex multiple interactions with the dopamine, gamma-aminobutyric acid, GABA, serotonin, opioid, and N-methyl D-aspartate, NMDA, neurotransmitter systems. Alcohol, food, and other drugs of abuse have similar effects on dopamine receptors. The development of addiction, including to alcohol, is affected by genetic predisposition and influenced by alterations in the rewarding chemicals released per dose. Substances of abuse are often put into categories based on their effects. Alcohol has effects similar to other depressants, which characteristics include decreased cognitive function while intoxicated, decreased inhibition and increased impulsivity, risk of overdose, development of depressive symptoms in heavy users, withdrawal symptoms like other depressants, symptoms of anxiety during withdrawal, substance-induced psychoses in some heavy users. The widespread use of methamphetamine stems largely from its potential to produce euphoria, reduce fatigue, enhance performance, suppress appetite, and induce weight loss. Coupled with multiple social, biologic, cultural, and psychological factors, this makes it a drug ripe for abuse. Methamphetamine abuse. Risk factors contributing to methamphetamine abuse include the presence of depression, childhood conduct disorder, a desire to enhance sexual pleasure, the manic phase of bipolar disorder, adult antisocial personality disorder, obesity, ADHD, cocaine addiction. Cocaine addiction is best described as a chronic relapsing disease. It is characterized by the compulsive seeking and use of cocaine accompanied by functional and molecular changes to the brain. The single most defining aspect of cocaine use disorder is the prominence of the relationship with the drug. The stronger the relationship, the more likely the patient is to continue problematic use despite internal and external consequences. Psychologic dependence, where a patient believes the drug is necessary to complete daily activities, alleviate stress, and cope with problems, is a symptom of stimulant dependence. Cocaine use disorder is diagnosed behaviorally. It is evidenced by at least 2 of the following within a 12-month period: persistent desire or unsuccessful attempts to cut down or control use, great deal of time spent in activities necessary to obtain the drug, failure to fulfill obligations at work, home, or school as a result of cocaine use, continued use despite persistent or recurrent social or interpersonal problems caused by cocaine use, continued use despite knowledge of a problem likely to have been caused by or exacerbated by cocaine use, important activities abandoned or reduced, recurrent cocaine use in physically hazardous situations, craving, tolerance, withdrawal. Cocaine abuse is a condition of frequent, binge-type use and continued use despite negative consequences, but with less severity and fewer behavioral symptoms than a use disorder. Cannabis use disorder. Although severe problems associated with abuse and dependence are less common among cannabis users than among other drug users, they do occur. Cannabis use disorder is a chronic relapsing disease characterized by compulsive seeking and use of cannabis. Functional and molecular changes to the brain accompany this behavior. The defining aspect of cannabis use disorder is the salience of the relationship with the drug. Individuals who use cannabis often believe it is necessary to get through daily activities, alleviate stress, and cope with problems. The stronger the relationship, the more likely the patient will continue problematic use despite internal and external consequences. Cannabis use disorder is diagnosed behaviorally. Evidence of a disorder includes cravings for cannabis, preoccupation with use of the drug, sneaking and concealing ingestion, loss of the ability to control cannabis use, continued use despite significant physical, psychological, social, or occupational consequences. Club drugs. The drugs MDMA, ketamine, flunitrazepam, and GHB have become widely used by college students while clubbing, and by a segment of the youth population that attends all-night dance parties known as raves. For this reason, this group of drugs has become known as club drugs. Sporadic use of club drugs seldom produces acute or lasting adverse effects in most people. However, heavy use can lead to psychological and physical consequences of variable severity and duration, depending on the agent, the pattern of use, and individual factors. Individuals susceptible to addiction can become compulsive users of these drugs and develop psychological dependence. Behavioral addictions. The term addiction is traditionally used to describe the pathologic behavioral patterns a subset of persons exhibit from exposure to substances with central nervous system (CNS) activity, commonly drugs or alcohol. Common features of addiction include repetitive engagement in rewarding, at least initially, behaviors, loss of control, spiraling engagement over time, persistence despite consequences, aversive states when ingestion is halted or substantially cut back, an appetitive urge or craving state prior to engaging in the behavior. Many of these pathologic behaviors have long been classified as impulse control disorders, including pathologic gambling, intermittent explosive disorder, kleptomania, pyromania, or trichotillomania. Research suggests that several of these impulse control disorders more accurately represent behavioral addictions. As a distinct area of study, behavioral addiction is recent, with extensive knowledge advances having been made in the last 15 years. We just scratched the surface of substance and behavioral addiction. Discover more addiction counselor continuing education at NetCE.